The recent raids on some pain clinics bring fear and concern for some patients and some doctors.
They're worried a push for government regulation will impact patients with legitimate pain. In tonight's Medical Watch, Meg Ferris explores that issue as well as newer ways to treat chronic pain.
Roderick Keith can't believe he can walk normally now without the excruciating pain in his low back, thighs, and ankles.
A lot of pain walking, standing. Many times I've gone to, say, Walmart or places like that, and I stood in the line. I had to leave everything there and just walk out. The pain was just so unbearable.
He was treated by Metairie interventional pain management physician Dr. Patrick Waring, using an X-ray machine to guide him to deliver precision pain relief through steroid injections.
Back pain is probably the second most common reason patients will see a physician, with common cold being the only thing that's more frequent.
He says the legitimate medical community finds the actions of health professionals who allegedly abuse their authority to prescribe narcotics reprehensible, likening them to running medical crack houses. But he is very concerned that the actions of a few will keep those in true need of pain management from getting legitimate treatment and medications.
The problem with this is that we're mixing problems. We have a huge problem in our community, in our country, of pain, and we have a huge problem of abuse and addiction of controlled substances. Those are two separate problems. To treat them the same is a big mistake.
He disagrees with parishes calling for moratoria on pain clinics. And he says Louisiana law makes it too easy for any doctor with a drug-writing license to prescribe narcotics. He says the answer lies in legislation before Congress called the NASPR bill, a bill that, if it becomes law, would allow doctors, pharmacists, and law enforcement agents to monitor people throughout the U.S. who regularly cross state lines to buy multiple prescriptions.
Trying to give the providers, the physicians, and the pharmacists more information in which they can make good decisions.
In the meantime, he says there are many ways to treat the huge problem of chronic pain. Through interventional treatments like this one. There are psychological treatments, physical therapy, and other doctors add that cognitive behavioral treatments, as well as diet, exercise, weight management, and even acupuncture can also manage pain.
The use of narcotic medications as monotherapy is discouraged. The use of controlled substances to treat chronic pain probably should be a later or last result rather than the initial first resort.
And while many doctors feel narcotics are effective to help acute and chronic pain, as long as patients are followed very closely, these opiates aren't the only effective medications.
There are many good non-opioid pain medications, many classes of medications such as antidepressants and anticonvulsants that are very effective.
Meg Ferris, Eyewitness News, Medical Watch.